And we do begin again today with the fast-moving Omicron variant. A new NBC News tally shows the U.S. has surpassed 57 million COVID cases, and health experts warn the full extent of this COVID wave has yet to come. According to the CDC, the Omicron variant accounts for more than 95% of COVID cases in the U.S. Listen to that. And to put that in perspective, just 1 month ago, Omicron accounted for 1% of cases compared to the once dominant Delta variant. And take a look at this map. In just 1 week, 33 states and Washington, D.C. have set records for COVID cases, hospitalizations, or both. President Biden addressed the nation about the rise of cases and the importance of testing during his public address yesterday. Take a listen.
We're seeing COVID-19 cases among vaccinated in workplaces across America, including here at the White House. But if you're vaccinated and boosted, you are highly protected. You know, be concerned about Omicron, but don't be alarmed.
We have a team with us this morning, including Dr. Bob Lahita, to break down the newest guidelines from the CDC, and NBC News global security reporter Dan DeLuce with an update on military support inside struggling hospitals. But first, let's bring in NBC News correspondent Sam Brock and NBC News White House correspondent Monica Alba. Good morning to both of you. And Sam, I will start with you in Florida. So you're outside Jackson Memorial Hospital, I understand it, where, like much of the country, you're seeing this spike, but actually you are in the state seeing the fastest spike in COVID cases. Listen to this, up 744% in just the last 14 days. Tell us how that hospital behind you doing. What's happening in your state? What's it looking like right now, Sam?
Savannah, good morning. Right now, Florida has seen just this explosion of cases in the last couple of weeks. As you said, about 700% increase in infections. At the same time, you have seen a lot more hospitalizations, but not at that level, a couple 100% instead of 700%. What does that mean contextually, though? At the height of Delta, which was over the summer in Florida, there was about 17,000 people hospitalized in the state of Florida. Right now, it's about 7,000. The issue right now for healthcare workers, Savannah, is not necessarily available beds. They have the beds. The problem right now is not enough people, doctors and nurses, to take care of sick patients. Attrition and folks who have gotten sick themselves working on the front lines has driven down the availability and capability of hospitals to care for COVID-19 patients. Those patients are not getting as sick as they were during Delta. That comes directly from the Florida Hospital Association. There's also another difference with Delta. Here's the president speaking with us yesterday.
During Delta, over 50% of our ICU beds were occupied for individuals being treated for COVID at the peak of Delta. We're at about 12% today of our ICU beds occupied for COVID. The biggest challenge for all of our hospitals remains the severity of the staffing shortage.
And Savannah, another example of that, only about 30 or 40 minutes from where I am right now in Fort Lauderdale, there is Holy Cross, which had to shut down its labor and delivery unit, not because of unavailability of beds, because they don't have enough people to staff that unit. They had to divert critical staffing shortages, divert those folks to other areas of the hospital care for COVID-19 patients. That's the kind of thing you could continue to see here in Florida and elsewhere as this crisis deepens.
Absolutely. And a reminder of what happens other than just those beds filling up from COVID patients. There's so much more fallout than that. Monica, let's bring you in here. So we mentioned we heard from President Biden yesterday, and we're expecting to hear from the White House COVID response team later this morning in a virtual briefing. What's the latest messaging there?
Well, ideally, we're going to be getting a few more specifics from that COVID response team, Savannah, because yesterday, President Biden conceded that the testing situation is frustrating to him. The fact that even the White House is falling short on its own promise that by early January, which is where we are right now, there would be this government website up and running or close to launch so that Americans could log on and get those at-home rapid tests sent to them via mail. As we all have seen and experienced, those are still very hard to come by. And the president did admit they would like to do more on this, but that he just couldn't announce anything further because the contracts are not even finalized. So that's something that really could stretch further into January. So we're waiting to hear more from the COVID response team. But I think you can also expect them to echo what the president hit home yesterday, which is that he said there's no excuse for anyone to be unvaccinated. And for those people who are vaccinated who might still be waiting to get their boosters, he said the time has never really been more urgent. So we could get some more information from the CDC today about particularly kids in the age range of 12 to 15 who might get final approval for their booster shots, and those timelines shrinking a little bit, especially for those who got Pfizer and the immunocompromised. So we expect to hear a little bit more about all of that. But the president's message also yesterday is what we expect to hear from these health officials. This is something to watch, to be vigilant, but not to be outright panicked at this moment.
And Sam, quickly before I let you both go, let's talk about the leadership in your state. Florida Governor Ron DeSantis is receiving some backlash for the way that he sort of categorized testing, calling for residents to not get tested if they're asymptomatic. First, let's listen to some of that.
You'll have certain people that will go out and will just get tested all the time at some of these sites, and that's not a good use of resources.
Testing people that have no symptoms, are not sick, and calling them cases, people, and making them into people who are sick when they have no symptoms. Let's go back to people making sort of voluntary decisions, living their lives, pursuing what they want, and not sort of defining everything that they do around whether or not a test is positive or something else like that.
So, Sam, tell us, how are people in the state responding to that? Are they struggling to get their hands on a test in the first place? What's been the backlash?
There was definitely a lot of curiosity, Savannah, as to how Governor DeSantis was going to address what is now a state that is awash in COVID cases. We had not heard from the governor in a couple of weeks over the holidays. So what was he going to come out and say? And yesterday, as you heard right there, asymptomatic people, according to Governor DeSantis, should not be getting tested right now, which really flies in the face of what scientists and infectious disease experts have been saying for weeks, months, years, which is that you can be asymptomatic and still pass the virus on to someone who is more vulnerable and will be symptomatic, could get very sick. So healthcare officials right now were apoplectic at what the governor said yesterday, and not just those remarks about changing the profile of who gets tested, but also he doubled down on monoclonal antibodies instead of talking about getting people vaccinated. Now, monoclonal antibodies, Regeneron specifically, did wonders for people during Delta here in Florida. But to kind of put all of your eggs in that basket right now, when you have a state that's 63% vaccinated, and where most of the people that are ending up in the hospital, including the 500 or so over my shoulder here at Jackson Health, are unvaccinated, you might have expected to hear more language on that, less on the monoclonal antibodies.
Sam, apoplectic. It's one of those words when used to describe something so well, it just really hits home. All right, Sam and Monica, thank you both so much for kicking us off this morning.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.